So today we're going to talk about big emotions, big responses. And whether you have a 5-year-old child or you're a 50-year-old man, everybody with ADHD and many people who don't have it are challenged with emotional regulation. So I'd like to welcome you today to the Attitude Live Facebook series. I want to say a few things about why this is challenging, particularly for people with ADHD. So we know that there are 11 executive functioning skills: verbal and behavioral impulse control, emotional control, working memory, organization, prioritizing, self-evaluation, goal-directed persistence, all of these things. And emotional control is something that is a biggie for people with ADHD. And the reason why that is because emotional control is fundamentally linked to working memory. And many people with ADHD struggle with working memory. In fact, research has shown that people who the stronger the working memory, the better the emotional control. Notwithstanding trauma, racism, and other kinds of extenuating circumstances. So why is emotional control challenging? And those of us who have ADHD and those of us who don't, we all have executive functioning strengths and challenges. So for me, one of my challenges is emotional control. I have big feelings, they're intense. I come from a long line of intense Jewish women. We all have had big feelings, and I struggle with this. And I struggle a little with time management. Sometimes I'm not as flexible as I would like, but the rest of my executive functioning skills are pretty well intact. For people with ADHD, it's often the reverse. They have a number of challenges in their executive functioning skills, and that overwhelm and outnumber the strengths that they have. So, what about emotional control? So, let's talk a little bit about how emotional control works in the brain. So, some of you may be familiar with Dr. Daniel Siegel, and Dr. Daniel Siegel came up with this great thing about flipping your lid. So, the brain, basically, this is the back of the brain. So, the brain develops from the back to the front and the inside out. The back of the brain is the physiological brain, also known as the reptilian brain. That's where our blood pressure, our heart rate, our basic functions, breathing, all of that is controlled back there. Then we have the middle of the brain. That's the emotional brain, also known as the mammalian brain. And we'll have in this part of the brain the hippocampus, the amygdala, the seat of language. This our emotional brain, the limbic system. That's in this part of the brain. And then the front of the brain is our thinking brain, also known as our human brain. And if we take our hands and put it on our forehead, behind our forehead is the prefrontal cortex. And that's the part of the brain that's in charge of executive functioning skills. When we are stressed, when we are overwhelmed, what happens for a lot of us is that we flip our lids, so to speak. And let me see if my hand is in the right place. Woo, there we go. So what happens is that our emotional brain, our amygdala, gets all puffed up and it comes out and it takes over our thinking brain. And now we're operating at a much more primitive level. Okay. And so it's just raw emotion and raw response. What we want to do is get that emotional brain, that amygdala, back where it needs to be in the back seat of the car. So the human brain, the thinking brain, is in the front seat of the car. How do we do this? So, one of the things that happens is we need to remember pre what we and this is what a lot of people with ADHD struggle with is previous experiences in various situations and applying how we succeeded or tools we used in those to this current situation. That's difficult. We have to slow things down so we can process more efficiently. And we need to access language to talk about what's going on rather than to rage. And so these are the tools that help us regulate that amygdala. The other thing that's worth knowing is that in ADHD brains, and in brains of kids who've suffered severe neglect or trauma as a child. Certain organs are smaller. The corpus callosum, for example, the superhighway of the brain that connects the left and the right hemispheres, those are smaller in people with ADHD. The amygdala, which is that fight, flight, or freeze response. The hippocampus, which is the seat of memory. These or and among others, these are smaller. And so with the combination of the smaller size, the less effective functioning because of perhaps less dopamine or less norepinephrine, you, as people who live with ADHD or have children with ADHD, are going to struggle a bit more in getting your emotions regulated. And those of us who don't have ADHD but struggle with emotional control, we have something similar. Many people who have anxiety, and I definitely struggle with a lot of anxiety. I come from that pretty naturally from given who my family is. We have to work because it's the same kind of thing. When we feel a little anxious, we loop into that stress reaction where the amygdala comes out and takes control. And we don't want the amygdala to take control because that's not its job. Its job is to protect us, right, in moments of stress. So I hope this is a helpful baseline explanation. Now let's have your questions. So does it mean Michelle's asking from the back of the neck, if the back of the neck gets bad, it's not going to the good parts? No, no, no. It just means how we develop. The brain, develops from the back to the front, and the frontal lobe connects with the rest of the brain in neurotypical brains around age 25, and in ADHD brains, there's about a 3-year delay, up to a 3-year delay, so it can occur a little later around age 28. So let's see. I think Susan asked a question. You are too sensitive. What I've been told you're too sensitive. What am I supposed to do with that? So we have talked about rejection sensitivity dysphoria before on this live, and here's the thing. I have also been told I was sensitive because I am sensitive, and that is okay. What is wrong with being sensitive? When someone says you're too sensitive, the response is I am sensitive, and that's what makes me special. That's what makes me me. I am attuned to other people. I think if I wasn't sensitive, Sharon, would not be as good a therapist. Maybe Susan, wouldn't be as good a friend or parent or a partner. So I think we want to look at our sensitivities and are the things that are different about us and take a heart in them because that's part of what makes us who we are. The question is our sensitivity hurting us? Are we struggling to move beyond that? Do we need to follow that typical rule in saying in Al-Anon, which is Q-tip, quit taking it personally? I think sometimes when people are sensitive, we take things personally that aren't about us. And there can be a lot of reasons for that. It can relate to having ADHD, but it could also relate to maybe growing up with a narcissistic parent or growing up in a family where there was physical abuse. There are lots of reasons why people take things personally. Okay, so Lori says, my 6-year-old cannot control his temper, outbursts, the yelling, he hates me, throwing things at me, trying to figure out how to help him. So here's what I want to say. When young children are flooded by emotion, in fact, when all of us are flooded by emotion, we regress. We regress into younger parts of ourselves. I'm sure there have been times where you may have lost your temper and you're acting like your 13-year-old self rather than your 35-year-old self or your 53-year-old self, as it is. So, what we want to remember is that we want to help kids try to notice when their feelings are building up, and sometimes it can be in a split second, and all of a sudden they've gone over the edge. In those moments, what we want to do is have a backup plan. When you are like this, when you are showing these behaviors, these are the things we agree on that's going to help you calm down. Maybe it's a hug. Maybe it's going outside and jumping on the trampoline. Maybe you just need to lie on the floor and cry and kick it out. But kicking me is not okay. And so I think in the situations, what you want to say is the 6-year-old cannot control his temper. You're right. And so if he cannot control his temper, what is the scaffolding that you need to provide that will help him control his temper? And the first thing is to give him neutral feedback. I hear that your voice is rising. I see that your face is getting red, and this tells me that you're getting very upset and we could be going off the edge. So let's do the things that we agreed that will bring you back. Let's have a drink of water. Let's play tag in the living room, whatever it is, or let's sit down and I'll read you a story that can help him start to settle. This is very important. He's not going to be able to notice this about himself. And what I would have to say is that if he is yelling that he hates you, I would ignore that. Who cares? He doesn't hate you. He's yelling that he hates you because he feels like he's safe enough that you can contain his disruption. When kids feel out of control, it is very scary. They do not like it. And they take it out on you because they want you to help contain them. Okay. And what does that containment look like? That's different in every family. For some people, that containment looks like we're going to go downstairs and we're going to, quickly go onto the treadmill. For other people, it's like, let's take the dog out for a walk right now. That's what we agreed on. And other times, it might just be going to the bathroom and washing your hands and splashing some water on your face. What is going to help you? What is language that could help a 6-year-old? Remember, a 6-year-old with ADHD is in that moment when they're out of control, like a 3-year-old. Okay? And what you would say to a 3-year-old who's having a temper tantrum is use your words. Use your words to tell me what's going on, what's not working, what you're upset about. That's processing that engages the frontal lobes. Okay, how to explain this to other people so they understand. LD, what I want to know is explain what to other people, and then I'll give you the idea. How to explain that we have big feelings, that we have big reactions, how to explain how the brain develops. What are you interested in? Althea, how do you learn to be more proactive and less reactive? That's a great question. So, I think the first thing that you want to do, and take a minute right now if while you're sitting there, and close your eyes and think about what things set me off. I knew that when my daughter was a teenager, and still sometimes today, and she's in her early 20s, what sets me off is when she, tells me I don't know what I'm talking about, when she shuts me down, like I'm not interested in hearing what you want to say. It's when I feel like I'm boxed in, and that would trigger me, and I would just get super angry. Um, and so then I had to look at, well, why did that anger me so much? It angered me because I want to help her, and she was rejecting my help, but not only rejecting my help, like really hard pushing me away. So that was triggering for me because I think in my family growing up, my parents very much were the type of parents we know what's best. And so it was hard as a sensitive kid to be like, well, actually, I have some ideas of what makes sense for me. I have some ideas of what works for me, and you're not letting me talk about it. You're making me do it your way. So, what we want to do to be proactive is to try to identify our triggers and then go underneath the trigger. This is what triggers me. Why is that so triggering? What is it about my life story that makes that kind of triggering for me? And then, what perspective can I take as a result of that? Because really, I'm acting out of that younger self, not necessarily myself today. And so if I were thinking about that situation with my daughter, what I would say is, what I want is for her to be, happier, not to struggle. And I had to look at like what my limits are. How she's going to have to learn her lessons for herself, even if it's hard for me to witness her pain. And that was really helpful for me. Like, what is my actual role? And so I think that's a really important thing to ask yourself when you're proactive, when you want to be proactive. What triggers me? What do I notice is happening in my body when I'm feeling triggered? Do you get a shortness of breath? Do you start to feel hot or flushed? Do you start perspiring? Does your voice rise? These are the kinds of questions that are a signal to us that we are heading off that emotional cliff. And then in those moments, we want to have a list that we can tap into right away of something we can do that's different, something we can say to ourselves that's reassuring, make a different choice. And that's how you're going to shift from being reactive to being proactive. Those three things. Laura says, maybe we're told that it's bad because if we weren't so sensitive, we wouldn't be so upset. I don't think sensitivity and the level at which you're upset are actually related at all. The intensity of your upset is related to emotional control. Your sensitivity and the rejection sensitivity dysphoria that we've talked about sometimes before has to do with the frequency with which you are triggered and the depth at which you're triggered. It's not the size of your reaction. And those are different. Dina says, maybe the problem is the other person's lack of sensitivity. I hear you on that. Um, Catherine says, what tools can help a child's emotion regulate a child's emotions when they are having big emotions, especially anger or frustration? So here's the thing with your kids when they're losing their cool, okay? In that moment, you are not going to be able to give them to work on any kind of solution because when the amygdala comes out from its hiding place, whoops, hello, its hiding place, and comes out, no listening is occurring. None. There's no listening. So what you have to do is come up with a plan, a strategy in a calm moment about that moment because those moments will reoccur. You know, you may be surprised. Oh, wow, I can't believe this is happening again. Why can't you? Of course it's going to happen. It's going to happen over and over until, until development steps in and there's been enough practice to maybe do something different. Okay? And that's part of the journey of being a child and transitioning into an adult and even throughout adult development. So, what we want to do is we want to notice one thing with our kids because kids can really work on one thing at a time. The pattern of what happens when they're triggered. What are some interventions that are going to help them calm down and then how to move forward. And I call this, and I talk about this in my book at length, stop, think, and act. You're going to cause a pause in the action when there's an escalation. You're going to have a think. That is when you separate. So with pause, excuse me, the pause is a separation. It's not a time off. It's not a time out. It's a time apart. Okay. And you're going to calm down. It takes between 12 and 15 minutes at least for the amygdala to settle. What's going to happen during that time? The think is when you come back together and you talk very calmly about what happened. What was it that upset you? What would you have liked to see happen instead? What could I have done differently? What could you have done differently? And then the final question, how do we move forward? What is the next right thing for us to do? Is it an apology because you bit your sister? Is it packing up your stuff so we can go for that hike we were going on? What is the next right thing? This is not a time to teach a lesson. We're still in the recovery. The lesson comes later in several hours later in the day or maybe the next day, and then you can come back and you can say, I noticed this happened. Let's talk about this pattern and what we can do in the future. It's very important in the midst of an emotional dysregulation, not to try to talk about rationality. We can't do anything until that amygdala has calmed down. So you want to prepare a strategy for these moments, and that's where stop, think, act comes in. What do I say as a parent when my daughter explodes to the smallest criticism and says everyone hates me or everyone is against me? So this is an interesting thing. So I don't know if you're aware of this, but in like the around 2008, 2010, uh, the University of Pennsylvania had did a lot of work, research on positivity. And Dr. Barbara Fredrickson wrote a book called Positivity. And in that book, she says that the ideal positivity ratio is 3 positives for every negative. And as I've traveled around the world, I ask people, what do you think the ratio is for you or for others? For every 1 positive, how many negatives per day do you think your child hears? How many negatives per day do you hear? And when I did this with a group of teens last year in California, this girl said to me, "Well, Dr. Sharon, is it what other people say to me or what I say to myself?" And I said, "It's both because it's the cumulative effect, right?" And so she said, "Oh, then it's probably like 1 to 30." So I said, "1 positive for every 30?" And she's like, "Yeah." So when your child is very sensitive to criticism, that's because A, she may feel like that's all she receives, and B, that may be all she tells herself. So we've got to shift that ratio for her. And that would be an interesting question to ask her, what do you think it is? Like for every positive thing you hear a day, how many negatives do you think you hear? How many would you like to hear? What could I say to you that would be different? So, uh, well, how can I give you feedback that isn't going to make you feel like I hate you? Ask these questions because kids have answers and they're so important what they have to say. Um, Kimberly says, "My child is 8 and her behavior is quite like a 6-year-old, just very silly and not typical of an 8-year-old. Her classmates are beginning to notice that she is not quite like them maturity-wise. How can I help her bridge the gap? She doesn't seem to notice at this time. Her teacher's noticing." So this is actually a common thing that kids with ADHD are act younger than their age. And this makes it very hard for them socially because other kids don't necessarily want to be with them because of the way that they're acting. And so I would talk to the teacher and ask the teacher if there's a person or two in the class who really gets your daughter, and for whom they can work together or pair up on a project. And if you're in person school, maybe sit near each other. And then I think I'd want to know if the school offers a social skills group, because that would be a really great place for her to practice some of the tools that we want her to learn. And that actually goes back to the question from Kioshia, excuse me, which is, what techniques can you teach children? So the thing for kids with ADHD is they need to learn their lessons in the moment, and so being in a social skills group is very helpful because they're practicing. It also would be useful if you could talk to the teacher and pick out 1 or 2 skills that you and the teacher both think your child would benefit from working on, and work on them together so that the child's getting the same kinds of messages at home that they're getting in school. Of course, school's online, so it may be different. That's a whole separate set of complications. Um, I worked with a client once, and he really struggled with, he was a long talker, and he also didn't have very good eye contact, and so people would, he just would go, he wouldn't be aware of or notice how people were responding, and he was struggling with friends. He was in 3rd grade, and so we decided to do at home. I talked to the parents, and we talked about 2 things. One, asking him to, your eyes on my eyes, or please look at me when you're talking, because then I know you're actually talking to me. And also saying, interrupting him, he was aware that people weren't paying attention, but he didn't know why. And so the parent said, well, sometimes you talk and you're not aware that I might want to say something, or that it's time for you to stop talking. So we came up with a signal, and he was practicing that, and then he practiced it at school as well. The teacher also had the same signal for him, and so he was getting the message in a number of different domains. LD, how do you help an older teen with ADHD who suppresses emotions? Well, um, that's a really good question. Teens share their emotions with certain people at certain times in certain ways. And of course, stuffing their feelings down is it's never healthy for anybody. But your teen might be showing emotions with other people, just not you, because your teen is trying to figure out, who am I? Where do I belong? How can I be responsible for myself and not depend on you as much? So in this case, what I think is, you can try to ask questions that aren't necessarily feeling questions. So questions that are more about how, that start with how, what. So how did you respond when that happened? Or what was it like for you when they said that? What would you have liked to, what would you wish you had said? Or what do you wished they had said? So you talk around, you sort of stay in the content rather than going to the feelings, and give them an opening to talk about stuff rather than asking directly. If you want to have, I found that if you want to have a productive conversation with teens, try not to do it face to face. In the car, on a walk, cooking together in the kitchen, something where their eye contact is not there. That's very intense, and a lot of teens won't tell you stuff right at your face. I also think that maybe going into their bedroom at night and just hanging out might help. Checking in, um, just making that connection, because before bed, kids often let their guard down and are more willing to open up than at other times. Jenny, I'm struggling this year with my daughter. This school year, she has been having a lot of anxiety attacks and hasn't been able to be in school. It seems to be around lunch and times when it's louder in class. Um, I it's good that you're talking about anxiety, because, I think that anxiety and AD, well, I know that anxiety and ADHD travel together a lot. Um, Next to oppositional defiant disorder, which is around 40% of kids with ADHD have that diagnosis, around 34% of kids have a formal anxiety diagnosis. In my clinical work and the clinical work of my colleagues, that anxiety actually happens a lot more often. So I would imagine that the lunch time, or other these loud times, they're a signal to you that she's overwhelmed, and she's overwhelmed in her auditory processing channel. And at lunch, she may well be overwhelmed visually. There's just too much information coming at her, and the response is anxiety. And why is the response anxiety? Because what she's showing you is she does not have the tools to cope with what's going on around her. And anxiety is the byproduct. Anxiety is always a signal. I'm uncomfortable. I don't know what to do. I don't know how to respond. I'm overwhelmed. And so we want to look at anxiety that way. What happens a lot of times is that we as adults or parents try to deal with the anxiety, like to solve the anxiety problem. And that isn't going to help. It's not the content of the anxiety that matters, it's the process of anxiety. So what is the environment that the anxiety is coming up? What's challenging about those environments? When do you notice it starts? And then trying to play with some of those environments to make them more palatable for her. Janelle asks, does the same apply for a 10-year-old? Not sure what the same is, but I'd probably say yes. Mapia asks, what's the difference between a 5-year-old with ADHD and a child that doesn't have ADHD? It's hard to differentiate sometimes. Extreme reactions doesn't always indicate ADHD, does it? No, absolutely not. So, there are a lot of differences between neurotypical 5-year-olds and 5-year-olds with ADHD. They have to do with, hyperactivity, impulsivity. They can deal with inattention. You might see a lot of busy behaviors. You might see more reactivity, having trouble managing their emotions. Those are some of the things that we see that are different between those kids. Linda, without a degree, let's see, I'm too smart without a degree, and I get treated like I shouldn't be as smart as I am. I'm extremely intuitive and extremely sensitive, as you have addressed, but it's just very frustrating because I know that people don't give me the respect I need because I don't have a degree. So, Linda, I just want to say, like, I want to give you a hug. Like, that is just crappy of people, and people are judgmental, and that is a problem with our species. I can understand why that might make you feel bad about yourself and disrespected. And I think it's important for you to remember and maybe to say to these people, you know, I don't have a degree, but I have a lot of life experience. My dad always says, I went to Life University. He went to college for 2 years and then he left. And he makes jokes about it, but he was a very successful, smart businessman, and he learned that through his experience. And so, for people who are alternative learners, and in this category, I include people who have ADHD, people who might have a learning disability, people who might be high functioning in the autism spectrum, people who have intense anxiety, people who've experienced trauma. All of these affect how a person can do conventional school. And maybe conventional school wasn't for you, but I'm sure you've learned a lot in your life. And I encourage you to wear that as a badge of honor. And if people look down on you for that, that is their problem. Q-tip, quit taking it personally. Jenny, she seems to not being able to cope this year compared to others. She's 11 and refuses to talk to me about these feelings. Parenting is hard. Emotions, hormones, COVID, and ADHD, I think, are a lot this year. Yes, I think they are a lot this year. I think it's really so very hard for kids and for all of us. I mean, we are all fed up way up to here, beyond our head. We all want to go outside without a mask and hang out with our friends and get some pizza, or, you know, um, go dancing or whatever it is you like to do. And so what I'm seeing for alternative learners is they are overwhelmed. They're overwhelmed socially, they're overwhelmed academically, and spending all this time on screen is very hard for them because they're missing all the things in a classroom that help them. Cues from peers, a teacher just walking by, putting their hand on the desk, saying, "Hey, no, try it this way." All of that is gone. So there's a lot more pressure on being self-reliant. Plus, one of my clients who has anxiety, she's in 8th grade, said, "I don't raise my hand in class because I don't want people to know that I don't know. Like everyone is looking at me." In a classroom, if you think about it, most classrooms, people are looking forward or they're in a circle. On screen, everyone can see you. And that's really hard for people who learn differently because they may not want to be seen. And so they remove themselves in some way, they shut down. What I would suggest is, to actually just validate what's going on for her. Of course you're struggling. Of course this is challenging. You know, let's talk about one area where we might be able to make a little tweak and see if that can improve that one area. Carolina, what are some coping strategies to help a kid walk themselves back before they get over the top? Great question. So, the thing that we want to do with kids is we want to help them notice what's happening in their bodies as they're heading over that before they get to the cliff, right? So, do you notice that you're talking louder? Or I notice that you're talking louder. It seems maybe you're getting angry. We want to offer them some cues about that, and then we want them to start to notice that themselves. And to verbalize it. See, it's the language of being able to say, "I'm getting angry" versus "I hate you." Those are very different. "I hate you" is that pure emotion. "I'm getting angry" is actually using the prefrontal cortex because there's some reflective capacity. I am noticing something about myself. So that's what we want to do. So when kids are close to going over the edge, in your non over the edge time, in your planning, in your strategizing time, you're going to brainstorm with them what are some options that they can do. And then you put those options on the fridge and you say, pick one. There are three. It's time to pick one of these. We're going to take a time apart for 15 minutes and come back and deal with this then when we're all a little calmer. You ease them into it. Liz asks, how do you motivate? And my son just says, I'm lazy. Okay. I don't personally believe in laziness. I believe in avoidance and procrastination. Um, Recently, a client said to her parents in a session, she said, "I'm not lazy. I have anxiety and ADHD." And I was so proud of her. It's a 20-year-old. And I think that's really important. You know, if your child if is telling himself, "I'm just lazy," we got a whole nother set of problems to deal with because "I'm just lazy" is just a negative pattern of talking to himself and thinking. What does lazy mean exactly? You know, when people procrastinate, they procrastinate for three reasons. Perfectionism. I got to get it right. If I can't get it right, I'm not going to do it. Avoidance. I dislike doing this, so I don't want to do it. And or this thing seems so big, I know I'm never going to do it, so I'm not even going to try. And productive procrastination. I'm going to do other things that I need to get done that aren't as big as this other thing, but I'm going to feel good about doing those other things. It's important to break down what laziness means, okay, and to motivate breaking down tasks into smaller chunks. The smaller the chunk, the better the chances that your child can do something. One of the reasons kids can't get started is because the task seems too big and unmanageable. Break it down, break it down, break it down. It's never too small. Harlan, my mother stopped my head banging the first and only time, and she said, "You know, I don't feel that." As I learned about personality separation, I got better at self-management. Great. Ellie Ray, how does sensory modulation and circuitry disorder impact on ADHD and emotions? Um, well, you know, like I think um, something like 10 to 20% of kids with ADHD process information through their senses inefficiently. And so that would definitely affect how you manage your feelings because your ability to be aware of what's going on in your body is significantly lessened, and your ability to accurately process what's happening is also reduced. You're welcome, Althea. Sissy, not taking any meds. What foods do you think it's good to focus on can trigger emotion? Specific, avoid. Mostly, I would say sugar, coffee, and fast foods. I think that those things really they're just not healthy for you, and they can also trigger different kinds of, you know, adrenal responses in the body. And I would encourage you to take some, you know, fish oil. There's a lot of articles on Attitude about, you know, non-medical treatments for ADHD, and certainly fish oil is one of the top supplements. Stacy, how do you deal with someone who is 13 years old with ADHD and seems oppositional disorder and brings chaos to everyone around her? So, uh, so with 13-year-olds, we get into this whole sort of stew of stuff. You know, there's pushback, there's, you know, sort of adolescent pushback, there's which is very typical. And then there's, you know, you add on to that some of the, you know, intensity of ADHD emotions and feelings, and you're going to get a lot, you know, more of an oomph behind that, which can, you know, present as oppositionality. Oppositional defiant disorder can be treated with some medication, and it can also mask other things. It can mask anxiety, it can mask depression. And so you might want to, you know, get your daughter an evaluation or talk to their primary care provider about, you know, meeting alone with her to sort of assess what's happening. um, I think that when kids are bringing chaos to situations, it's because they feel chaotic inside. And so, in those cases, I think some counseling would be helpful. And I probably would suggest some kind of family counseling because you're all on the same team here. You want her to succeed, you want her to live a life that's satisfying and content and confident. So, how are you going to do that? Jenna says, I go through periods of more intense meltdowns and anger outbursts, but with hard work, I can get myself under control. It takes um, a lot of effort to do this. So I find that every few years I get exhausted with the effort and also angry that no one knows it is taking as much effort as it is each time. Like my family saying or thinking, oh, that was years ago, she's better now. This eventually feeds back into my next set of meltdowns and makes them worse. I'm really sorry to hear that, Jenna. And what I want to say to you is that, what other people say about you is so much less important than what you say about you. And I know it's hurtful. And I think what would be helpful is for you to come up with a phrase or two to say in response to that. So if they're saying, oh, you were like that before, but you're not better, you can say something like, I work every day to be different, and it's hard work. Or I work hard every day to make different choices and be different, so that they understand that this isn't some sort of fly by night thing that's happened. And that may not be the language that you use. Let's see. I just want to check. Linda's asking, when do you do these live events? Is there a specific schedule? Yes, on Fridays at 4. Um, let's see. Althea says, intelligence is not what you get from college. Knowledge, hopefully. Exactly. Emily, 100% with you there. Big hugs and solidarity. It's such a tough year. I keep telling myself this won't last forever. Effie, hi from Cyprus, EU. Hi, Effie. What is the worldwide rate of comorbidity for petite mal and ADHD? Effie, that's an excellent question. I actually don't know the answer to that, because petite mal seizures are usually handled by physicians. I'm a psychologist. I would encourage you to check any of the ADHD world sites for that answer. If attitude, you have the answer to that, please post it. Um, Effie, you're referring to a 6-year-old. Okay. Stacy, how do you work with a 15-year-old that doesn't have his frontal lobe developed at his age, lacking empathy and compassion? So this is a great question. This will be my last question. And I encourage you all to join me next Wednesday at 1 o'clock. I'll be doing a live webinar on motivation in the mid-year, restructuring, recalculating, and getting us up and going. Um, I think if you have a 15-year-old who's a 15-year-old boy, he's probably more like 12 in a lot of his emotional development. And boys often mature slower emotionally than girls anyway because of how we're socialized. So if he's lacking empathy and compassion, then I think what you want to do is roll it back a bit and ask him to report, what does he see is happening for you? I notice, what do you notice is happening for me right now? Or what's the expression on your sister's face? How do you think she might be feeling? I mean, in some ways we have to go back and start to teach these things because he doesn't have it yet, and he doesn't have it the way other 15-year-olds for sure. So if you can think about him as being younger in this way, I think it will reduce your frustration, and then work on just neutrally giving him some feedback, awareness, noticing observations, asking him questions where he has to notice how someone else is responding. Okay, so I want to, good luck, Stacy. Yes, it's exhausting. I'm sure it is. You know, um, Stacy, when teenagers push you away, they're really, it's about themselves. And I struggled with this a great deal. And when uh, with my daughter, to be perfectly honest. And, I used to think of this thing in yoga, to root down, to rise up, that I need to stay rooted and steady because her job is to come up and push against me, and my job is to stay steady. And I wasn't always very good at that. I think it's hard for anyone to stay steady when someone's, cursing at you or saying inappropriate things or just shutting you down. Um, so, if you can, let her know that that kind of language isn't okay. She may disagree with you, that's fine, but talking to you that way is not really an option. I used to say fresh is for vegetables. And Ellie Ray, what if you could tell me what APD is? I'm not sure what that is. That would be helpful. Um, LD says I'm all about counseling. My teen is reluctant. We've seen a family therapist. Um, yeah, I think you should keep encouraging her to go. And if she didn't like the family therapist, she might do better talking to someone on her own first, but for you to have occasional family sessions. Okay, well, thank you very much. I really appreciate your tuning in. Again, I want to remind you to join me on Wednesday for my webinar. And I will also want to thank you for just being part of our community. Please check out the Attitude website for more resources and take a second and go to my page on Facebook and like it. I'd be very grateful and we'll stay connected that way. And check out the resources on my website as well, www.drsharonsaline.com. Currently, there's a sale for everything that's in the store. Thank you so much. Have a wonderful weekend, and I will see you next week. Take care. Bye bye.